Hello, my name is Stanislav Chernonog, and I'm the author and creator of the school Vector Massage and Somatics, and today we will talk about an extremely important topic that worries a huge number of people, even if you don't know about it. The topic is intercostal neuralgia. A huge number of people think that they have problems with a completely different system. Sometimes people suspect that they have a heart disease, but they actually have intercostal neuralgia. At the moment when people find out that they have intercostal neuralgia, they get the impression that it is difficult to treat. People can struggle with this problem for years, and at the same time, in a huge number of cases, 2/3, maybe 3/4 cases, this problem is solved in a couple of days. If you have a chronic form, you can solve the problem in 1 or 2 times. If you have an exacerbation, then you will need 3 to 4 procedures to make you really feel better. I have a huge number of stories that illustrate the thesis. People are afraid of the sensations that intercostal neuralgia causes them. For example, I had a patient who said, "In no case, do not work with my chest, because I have a sick heart. Every time they put pressure on me, I have problems. I have a headache, I have problems with my legs. We work with the pelvis, with my legs," and he has been suffering from problems with his chest for many years. There, as far as I remember, he struggled with this for more than 10 years. Imagine his surprise when, after working for half an hour, we completely solved this problem and it never occurred again. He had other health problems related to his head and pelvis, but after we worked for half an hour, his intercostal neuralgia ended and ended forever. This is a simple technique. It is a technique that you can implement yourself to work with yourself, and you can learn to work with yourself or with other patients. So what is intercostal neuralgia? The fact is that we have a thoracic spine, which differs from all others in that ribs are attached to the spine in the thoracic region. It differs not only in this, but in the fact that the nerves come out between every 2 vertebrae in the thoracic region and go strictly between the ribs. If we are talking about the lumbar, cervical, or sacral spine, then the nerves are quite difficult to intertwine with each other. When we talk about the thoracic spine, each nerve goes between its own space between 2 ribs. This is an important detail. Nerves exit along the front surfaces of our body, along the front surface of the spine, and dives into the space between the ribs. The space between the ribs is occupied by intercostal muscles. There are external intercostal muscles and internal intercostal muscles, and somewhere between these muscles there is an intercostal nerve. What is so terrible about pinched intercostal nerves? The fact is that firstly, the intercostal nerves being pinched causes severe, unpleasant pain. If this pain appears for the first time, then this pain produces a sensation of a hit in the stomach on the patient. It is an acute, sharp, unexpected pain and quite excruciating. Most patients get scared because it is very similar to the feeling of heart pain. We are pretty bad at distinguishing where our ribs are, where our heart is, and accordingly, when a person has intercostal neuralgia for the first time. I also had it. It's very unpleasant, sharp, and frightening feeling. Most people immediately suspect that they have heart problems and they will soon die of a heart attack. They also ensure not to go to the doctor ever, because God forbid they find out something terrible and their life will end. Let's forget about the fact that I felt stabbed in the chest. Maybe it'll just go away. Or even worse, a person may think that he needs to improve his health and will go for a run, and it will definitely make the situation worse. Because if there is a problem with the intercostal nerve pinching, physical activity in most cases will only worsen the problem. In addition, chronic intercostal neuralgia leads to a specific psycho-emotional state. Due to the constant pressing pain, people bend even more. This leads to a general depressive state and loss of strength. In addition, this is a rather unpleasant situation because the spasm of the chest muscles leads you to the fact that the body stops breathing normally. And this in turn leads to compression of the lungs and to compression of the heart in the heart bag. Thus, intercostal neuralgia is not a problem that leads to problems with the heart and lungs. but the body's reaction to intercostal neuralgia can lead to a serious lung problem, inflammation, bronchitis, and a significant increase in the risk of cardiovascular diseases such as heart attack or problems with blood clots. Something about which few people know is the appearance of shingles. The fact is that 98% of people have a herpes virus in their spinal canal. At the moment when the nerve is pinched on a regular basis, the intercostal nerves are pinched. This leads to a significant increase in the occurrence of herpes along the nerve. It's called shingles. Relatively speaking, if a person has intercostal neuralgia and has experienced stress and stopped breathing, then this leads to increased pinching and this can lead to shingles. This is very unpleasant. A person has a rash on the side surface, a strip of herpes. It is very painful, very unpleasant. I have observed people with shingles and this is a painful experience. It is not only unpleasant, it is also harmful because herpes destroys your body's immune system. And now let's see in practice what to do if you have a suspicion that you have intercostal neuralgia, how to be treated, how to prevent it, how to treat patients. We will tell you everything now. So, from theory to practice, neuralgia occurs in the mid-thoracic region somewhere from the armpit to the lower ribs. It will be enough for you to work on the side surface of the chest where the armpit ends and vertically down. You need to feel the ribs. Each of you can now put your hand into the side surface and find that there are places on the side that are soft, and there are places that are hard. The places where it is hard are the ribs. The places where it is soft are the space between the ribs. You need to walk along the lateral surface of the ribs. These will be stripes directed downward and at an angle, and going forward and down. These will be spaces between the ribs. You need to find a place with acute soreness if you have intercostal neuralgia. I assure you, even if you do not have intercostal neuralgia in an acute state, you will find a lot of sensitive places. I emphasize that it is necessary to press in the space between the ribs. We are not pressing on the bones. We are pressing into the space between the ribs where it is soft. Here we have found some painful place. The patient clearly signals that we have found the right place. You need to lower the pressure below the level that will be painful and painful for the patient. You need to find the level of load that will be comfortable for the patient. After that, you can ask the patient to inhale into the area where your finger is located. Most of us do not know how to inhale into the area where our finger is located, but nevertheless, oddly enough, we succeed. After we have inhaled, we need to hold our breath and hold it for 3 to 5 seconds. 20 seconds will also be good. If you do it yourself and find a painful place, determine a comfortable load and take a breath. After that, make a smooth and slow exhalation. We continue to hold the finger in the place where acute soreness has arisen. With surprise, in most cases, you will find that the level of soreness has decreased significantly. This is due to the fact that the soreness is associated with a spasm of the intercostal muscles. The muscles in the spasm tighten the ribs, and this leads to pinching of the ribs between each other. As soon as you inhale, you stretch some muscles. As soon as you exhale, you stretch other muscles. Some muscles are responsible for inhaling. The second muscles are responsible for exhaling. Thus, a deep breath will stretch some muscles for you, and a deep exhalation will stretch other muscles for you. Thus, the space between the ribs increases and the nerve is released. Your task is to go through the entire lateral surface, find all the points of acute soreness, and work out each of them separately, consistently, and systematically. So we have 12 edges. There are 11 intercostal spaces. You need to take only 11 breaths on one side and 11 breaths on the other side. In some cases, when the situation is acute, you will need to repeat the inhale and exhale procedure at the time of fixing the problem point several times. Thus, 20 inhalation-exhalation cycles are enough for an acute point. Because as a rule, if some place is inflamed for a long time, spasm for a long time, then the body needs to spend time to relax. The great thing about this practice is that when you have done this procedure once, as a rule, you will not need to do it a second time. Very often, one procedure is enough. It must be remembered that this is not a general scenario. In some cases, problems with intercostal neuralgia are associated with the fact that the ribs have come out of their attachment points to the spine. In some cases, it's a traumatic story. In some cases, it's really heart problems and you should go to a cardiologist who will check your heart. It will never be superfluous. But if you now take and work with your intercostal spaces, if you find pain, if as a result of inhaling and exhaling, this pain decreases or disappears altogether, then you have intercostal neuralgia and you have just cured it. Thanks for watching this video. If this practice was useful for you, then make sure to let us know about it by giving this video a like and leaving a comment. Subscribe to our channel, the channel of Vector Massage and Somatics, where we teach you how to do massage and earn money from it. By the way, in the self-help section, we are going to record a video dedicated to knees. If you don't want to miss it, be sure to subscribe and turn on the bell. My name is Stanislav Chernonog, and until next time, take care.